Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video about food sensitivity testing. Somebody had commented on one of my other videos asking if I had any thoughts or feelings about food sensitivity testing. And I have thoughts and feelings about lots of things related to healthcare and medicine and testing and things like that. And food sensitivity testing is certainly no exception. Um, with When it comes to food sensitivity testing, I actually recently gave a presentation at my old alma mater, the Canadian College of Naturopathic Medicine, about laboratory evaluations for and other diagnostic evaluation techniques for digestive tract disorders. And so one of the things that I delved into there was the research literature looking at food sensitivity testing. So, when we look at the scientific literature, to my understanding of it at least, from what I've seen and read and have presented on, is that food sensitivity testing has been studied with respect to a range of different conditions. It's been studied with respect to digestive disorders, including IBS. It has been studied with respect to autoimmune conditions, the impact of a diet that's based on food sensitivity testing having an impact on obesity, on migraines, and there's a few other conditions as well. And by and large, most of the research will show, most of the studies show that there is improvement in the individuals who follow the recommendations of food sensitivity test compared to those who do not. So in the study, they'll typically have a control diet. Sometimes that control diet is just a kind of standard, like healthy diet. Sometimes the control diet is they just give the patients a random list of foods to avoid, and like just I don't know exactly how they come up with the list, but I assume that they're random. But that's essentially what they're comparing. And by and large, most of the studies show that there is a significant improvement in those following the diet compared to those who follow a controlled diet. So with that information, if we left it there, you'd think, okay, sounds like food sensitivity testing, probably a good idea. However, the plot does thicken a little bit. When we actually look at the studies, what I find to be really interesting is that some of the studies, when you look at the list of foods that folks avoid on the food sensitivity, or the list of foods that folks avoid based on the food sensitivity testing compared to the control diets. There's one study in particular, I believe it was on for IBS, I'm quite sure. And when you look at the list of foods that were avoided based on the food sensitivity test, some of the most common food culprits, including wheat, other sources of gluten, dairy, were avoided in a majority of folks who did the actual food sensitivity testing, and where only a minority of individuals doing the control diet were avoiding those symptoms or avoiding those foods. And anyone who's been in clinical practice for any length of time will be able to attest to the fact that gluten and dairy are two of the biggest triggers for a lot of folks that are out there. So I feel like when we look at a study like that, it's like, oh, there was significant improvement with from the food sensitivity testing motivated diet. And yet it's like, well, I feel like the cards were really stacked in favor of that diet. And when we actually look at when I looked at the list of foods that were beyond just wheat or gluten and dairy that were avoided, um, there were also a lot of foods that are higher in FODMAPs, or fermentable oligosaccharides, monosaccharides, disaccharides, and polyols. These sugars that are present in different foods to varying degrees that can easily be turned into gas and therefore cause bloating and digestive issues. There were quite a few higher FODMAP foods in the control diet compared to in the food sensitivity testing based diet. So when we actually dig into the research literature, when we actually dig into the studies, it's like, there are some, I think, variables there that are skewing the food sensitivity testing results to look kind of better than maybe they would have if things were maybe a little bit more balanced or more factors were taken into account. Another thing that I find to be clinically interesting and relevant when it comes to looking at these studies, is that at least the ones that I took a look at, when they disclose what's on the various diets, and they don't always disclose that, which I think is troubling, but usually they do. But when they look at, say, there's the one study looking at folks with autoimmune conditions, and I'm trying to remember now, I think there were a few different autoimmune condition types that were in this. I think it was some pooled patients, like patients with, say, rheumatoid arthritis or psoriasis or things like that. And when it came down to which foods were the most problematic for them, as evidenced by the fact that they cut these foods out based on the food sensitivity testing, they were feeling better. then they reintroduced the foods, and then they paid attention to which foods brought symptoms back on. Interestingly enough, and not surprisingly, the most problematic or most common culprits were gluten-containing foods, dairy products. I think potato might have been on that list. I think maybe egg was on that list. And so, and that's good to know. But what I think from as a clinician is thinking, well, if a patient came in to see me, they had digestive issues, skin issues, autoimmune issues, whatever it happened to be, we're probably going to talk about their diet. And if I didn't have access to food sensitivity testing, I would say, well, why don't you consider going on this hypoallergenic diet, or go on this gluten-free, dairy-free, sugar-free diet, or go on this paleo diet that's gluten-free, dairy-free, and sugar-free by default, and there's no potatoes on that diet, and various other things that are minimized or avoided, and let's see how you feel. And so the subtext there is that, well, if the most common culprits that come up on food sensitivity testing, or the most common, the foods that are the most consistently relevant to patient outcomes are the ones that are coming up on the food sensitivity testing, then is there a lot of point in doing that food sensitivity testing in the first place? Bearing in mind that at least here in beautiful Canada, there aren't any insurance plans to speak of that cover this type of testing. So the least expensive testing option I'm aware of is about $250 Canadian, give or take, which is maybe like $200 US for comparison. Some panels are much more expensive than that. And does the testing actually give us clinically useful information that we might not have figured out anyways through recommending some fairly standard recommendations? If the study results were coming back showing, like, by golly, the patients felt so much, like some patients felt so much better when they cut out pistachios and watermelon and asparagus, and like, who would have ever figured those out? It's just, like a needle in a haystack. That, in my opinion, would be really, really important. But if ultimately the tests are coming back saying, yeah, gluten, dairy, refined sugar, it's like, well, my kids could tell you that, because that's why we don't have those foods in the house. It's not something that we necessarily need a test to tell us about. Now, I'm all for using this testing if clinicians find it clinically relevant, and there is certainly something to be said about having a piece of paper telling you, oh, you have an issue with gluten or wheat or what have you, and that makes it maybe easier as a patient to follow those recommendations. That's wonderful. But this is the type of conversation that I have with my patients when they ask about food sensitivity testing, or we're talking about options, where I'll say, I think you need to change your diet. Would you please consider this diet? There is food sensitivity testing options, but it costs this much. These are the limitations of the testing. This is what the research literature says. And 99% of the time, my patients choose to not do the testing. If they do the testing, that's all well and good, but it certainly does have its there's nuances to it that well, anyways, I've just spent the last 8 minutes talking about. So I hope that this answered the question that was posted on the other video. If anybody has any other questions or any questions on this topic, or questions about anything else, please post them in the comment section below, and I'll answer them as soon as I'm able to.